Everything will be better if you think you have a good doctor, you think you have good healthcare deliverers.
Welcome to the Learn Skin podcast with me, Dr. Raja.
And me, Dr. Hadar, where we discuss all things skin.
Join us as we delve into the art and science of skin health in today's episode.
Hey, Raja, can you say the thing I told you to tell them?
Of course. We are board-certified dermatologists. This podcast is meant for educational and informational purposes only and is not considered medical advice, nor does it serve as a substitute for professional care by a doctor or other qualified medical professional. All opinions shared do not express the views of Learn Health, Inc. Let's get to the good stuff.
Hey, Raja, how are you today? Oh, wait, Raja is not here. What am I doing? Well, folks, I'm here solo today. Well, not exactly solo. I do have a mystery guest, which I'll introduce in a minute. But the Learn Skin team has sent Raja on a covert operation in an undisclosed location. So when he comes back, he'll join us. But in the meantime, sit down, relax, enjoy with me, and listen to this very interesting episode in which we have a great guest. Because, a lot of times we are doctors and healthcare providers sitting across from a patient in a treatment room. And in fact, in this program, we have been discussing this topic of the patient-doctor relationship for many episodes, actually. I think it comes up a lot of times. But what we haven't really discussed is it from the point of view of the patient. And here is something that is really unique because recently came across my desk this wonderful book by Dr. Bill Eaglstein, which I'll introduce in a minute. And this book is fantastic. It's titled From Vulnerable to Empowered, Transforming Your Medical Health and Doctor Experience. And this book really discusses this kind of experience between the patient and doctor and really talking to patients about medicine and doctoring and kind of give you, the patient, a sneak peek into behind the scenes of many aspects of healthcare. And specifically, some parts of it are focused to the United States, but a lot of it is way beyond that. And so I thought it would be great to talk to Bill in person. So let me introduce Bill here. Hey, Bill, welcome to the program.
Thank you. Thank you very much. Happy to be here.
Let me try to really give an introduction to Dr. Eaglstein because he's had really an incredible career and now is looking to his next episode. But I think, Bill, if it's okay with you, I'll give a brief version for the audience to really understand the background that you have because it's really spectacular and really varied, which I think gives you the right perspective to write this book. So trained in medicine and worked as an U.S. Navy doctor, then trained in dermatology, went through the ranks of the academic career, became a professor of dermatology, and then chairman of no less than 2 different departments in dermatology, one at the University of Pittsburgh and then at the University of Miami. Then to spice up his career, he spent some time as Robert Wood Johnson Foundation Health Policy Fellow, and then also spent some time as a research doctor in Japan. So really interesting career, but wait, he didn't stop there. He also served the FDA as chairman of an advisory committee, as well as an advisory panels for the NIH. And finally, he spent some time as VP at Stiefel, which is the GlaxoSmithKline company. Whoa, that's a tongue twister. Okay, so really, I mentioned all this. There are many awards that Bill has won and mentored many, many doctors, and I'm privileged to be mentored by his mentee. And so the impact cannot be summarized in one paragraph, but suffice it to say that Bill has an incredible background, very varied, that brought him to write this particular book, which is what we want to focus on today. So, Bill, I want to get started by asking if you can tell our audience, what is this book about?
This book is about medicine and medical care from the patient's perspective. Actually, there's no reason people should really understand medical care beyond their encounters with it. In other words, there's no training for most people in what is medical care, what are doctors, what can they do, what are they allowed to do, what are patients supposed to do. There's no formal understanding or way to be trained or generally understand medicine. And I thought this book would be helpful to people by doing some of that, by making some of this information more formal. Everybody thinks they understand what a doctor does, but actually I think, in fact, they have a very limited understanding. And of course, the less they're involved with the medical system, the less they understand. So this book was aimed at public education about medicine and medical care with the idea of making people better able to utilize medical care and better able to understand what's happening to them when they're in the system.
Yeah, no, excellent. And who's this book for? Who do you envision as the audience?
Well, I first envisioned it being for the older person, but not the person that's so old that they're totally immersed in medical care, but rather the people that are, say, in their 50s and 60s and are likely to soon be needing a great deal of medical care. I learned from many reviewers of my book that, and I could see their point, that it's really very useful for people who are going into medicine, younger people who are considering medicine or another part of the healthcare field like nursing or pharmacy or any part of medical care where they kind of have a vague notion of what it's all about. They've seen it on TV. Maybe one of their parents or their relatives is a doctor or a nurse. But this will give them a kind of a formal understanding that will be helpful to them in selecting what to do. Maybe they'll decide they don't want to do this, to go into medical care. So I think that's another audience. So it could be for anybody, but actually when I wrote it, I was thinking of the older people that are not old enough to be totally immersed in the medical care system at this point. But actually everybody could benefit from reading this book.
Yes, actually, you took the words out of my mouth because I am a practitioner now for at least 10 years, seeing patients on a daily routine. And I picked up this book not having high expectations. And reading this, actually, I thought it would be probably for patients. But as a clinician myself, I learned quite a bit, both some things on the history of medicine and give you a very different perspective, which I really appreciated. Now, we're talking here, and people are probably imagining this kind of, oh, this is going to be a boring book about medicine and history of it and the interaction. Let me tell you, folks, if you look at this book, it's actually quite short, which I love. It's to the point. Every chapter is about 2 to 3 small pages. You can read it basically on a short flight, if you will, and then keep it on your shelf for reference in the future because it really makes you rethink your relationship with your physician. And if you're a physician, actually your relationship with your patients. And what I like about this, Bill, is you start every chapter with some quotes that a lot of them are really, really funny. So if it's okay with you, I would like to read some because these are not, just to be fair to those who are quoted here, these are not your direct quotes, but your selection to put it in the right place, the right time really cracked me up. I was laughing out loud reading these. And so I had to share this with the audience. If it's okay with you. For example, there's a chapter here named Consultants, Experts, Specialists, and Generalists. And this chapter starts with this quote, with these 2 quotes. Here we go. An expert is somebody from out of town with slides, which I thought was hilarious. And then here's another definition of an expert. An expert is somebody who is more than 50 miles from home and has no responsibility for implementing the advice he gives. Gosh, I thought that was great. There's a few of these I'm going to try to read through this episode. But Bill, I wanted to ask you, why did you decide to write this book around this time? Is there something in our times that you think really calls for a book like this to be written as opposed to 30 or 50 years ago?
Well, partly it's that it's my time in life and that I'm semi-retired. But also I did think that times were propitious for this kind of book because I think people have gotten used to technology and many have started thinking about doctors as kind of auto mechanics for the body or body mechanics. And I think they are parts of systems that fortify this kind of thinking. You belong to a big system and no one encourages you to choose your doctor. People just have a doctor, and the idea is all doctors are the same and they're interchangeable, and you are just a body that these doctors will work on as a mechanic would work on a car. So I think that's all a consequence of such great technology as is available today and the changes in the delivery system where it's much less personable. So I thought that those 2 factors made this book particularly worthwhile right now.
Yes, no, I agree. And it's really an empowering kind of way of thinking. And I want to, to me, it's mind blowing. And I'm still learning from you, Bill, even now as we speak, because thinking of having that kind of point of view, that kind of breadth of thinking is really incredible. Thank you for doing this. So to empower patients is really important. But I think somewhere in the book you write, or maybe it's in the beginning, I think, the doctors are actually prohibited by law and oath and custom from doing what patients want, which is true, and actually a very strong contrast that I feel sometimes myself as practicing in clinic. How does that need of doctors sometimes to not do what patients want, how does that go in contrast to your goal of empowering patients to actually take ownership of their care if the doctors say, well, that we can't do?
It might seem to run counter. Again, thinking about an automobile, for example, people need to understand that this is not a buyer beware market. In other words, if you go for a car and you choose the car that absolutely is not good for you, you're an old person and you choose a sports car which is hard to get into, you're a family person and you choose a car that won't accommodate children, well, that's kind of up to you and it's your problem. But healthcare is not that way. Healthcare is something where the physician is by law required to do what is considered to be right. And that's also by oath and by custom. So while it may seem to be limiting, I'm saying that you are empowered within the limits, but you're not allowed to say, I want this care even if it is going to kill me. That is within the limits. So I'm saying within the limits of law and of custom and of proper behavior on the part of medical people, I want you to feel empowered. But on the other hand, I want you to understand that you can't go to a doctor and say, inject some poison into me or do this procedure which has a high probability of producing a bad outcome. There are limits to your empowerment is within a context of limits.
Well, let me take this question from the angle of the clinician, because you're a very seasoned practitioner. Can you advise some practitioner, and especially in dermatology, right, which is often busy with aesthetics, appearance, some elective procedures? How should a clinician really approach this kind of patient that comes in and says, I want to have this done, even though it's not really warranted, be it in the aesthetic or also in medicine, right? Patients come in and say, hey, doc, I saw this pill on TV. Can I just get that? And you encounter these very, very well-informed, but also very adamant patients, and you're the clinician all of a sudden are feeling like you're backed against a wall. How should the clinicians approach this?
Yes, well, this is an example of what we were talking about earlier, that technology has made this more likely or more common. In other words, because of the internet and because of the ready availability of information, people, and also in our country, because drugs are advertised, people come in with their own ideas. I mean, historically, people didn't go to the doctor with their idea of what to do. They went to the doctor and they were sick, and the doctor was going to know what to do. As you know, and as our audience knows, where people come with their own ideas. And we encourage them to do that somewhat. On the other hand, what doctors need to be able to tell people, and it would be good if people already understood this, is they can't do what patients might want if in their estimation it's going to be harmful. The courtroom standard is if it's not in the standard of the community. In other words, if a case is heard in a court, you might say, well, what is the line? Where can the doctor do something and where can the doctor, or should the doctor say, no, this is not something I can do? And the line is usually considered the community standard. So if the patients come to you with cosmetic issues and the idea of doing certain things, and you feel that there would be a side effect that is highly likely, you have to explain to the patient, and it's hard to do. I mean, a simple example is the people that come and want antibiotics for their viral infections. This is an everyday
Right.
occurrence. And each doctor finds his or her own method of dealing with this. Many, I'm afraid, go ahead and give the antibiotic. But if they were willing to spend the time to explain they might be able to convince the patient that they simply can't do it. And of course, patients can't make doctors do it, so they can just say, no, it's something I won't do. But it's a hard thing. And the example of antibiotics for viral disease is a good one because it's something most of us have faced.
Right. Absolutely. And you mentioned earlier this kind of attitude of physicians as mechanics who will come and fix thing. And I think it can play both ways. Doctors a lot of times are really, grinded by the system and kind of give up and start thinking as, okay, I'm just a small little cog in the machine. I'll just give the antibiotics and move on because I just want to move to my next task. And I'm just going to deal with the skin and forget about the gut, and I'm going to just do that. But it's also from a patient point of view as well. So it goes both ways. I want to read another quote as a kind of a segue to my next question, which I thought was really funny, but also at a great point. So here we go. This is attributed to Sir William Osler in chapter 6, talking about doctors and therapy. So some years ago in London, an elderly woman told her doctor that she was invited to go on a safari in East Africa, in an area several hundred miles from the nearest doctor. So she wanted to know if the doctor felt it was safe for her to accept the invitation. The doctor told her that while the difference between being treated by a good doctor and a bad doctor was enormous, the difference between having no doctor and a good doctor could hardly be measured. All right. Fantastic. And, if you want to hear what Bill thinks about it, you got to get the book and read it. But I wanted to ask you, because this speaks a little bit about the good doctor, the bad doctor, and about some stigmas that exist now on doctors, which I thought was really useful, because there are stigmas, especially in the United States, about physicians who kind of become machines that kind of operate under the axiom of ill to the pill, or really are kind of handicapped by the entire medical industry around them. But I actually came out reading this book feeling empowered myself. And can you talk about, from your perspective, the erosion of the physician status or the stigmas that are associated with physicians nowadays? Maybe you don't feel like that, but it seemed to have eroded over time. Do you agree? And if so, why do you think this happens over time?
Actually, I think that doctors are held in perhaps less esteem now than they were in the recent past. But overall, I think doctors are still held in much more esteem than most other professions. I mean, their surveys always show doctors are the most respected of all the professionals. So I don't think that doctors are not held in esteem. I think they're still held in great esteem, but I think that they're a little less than might have been 2 generations ago. I'm not sure I'm answering your question, but broadly speaking, I think 2 generations ago, doctors were held in even greater esteem. And that might be slipping relative to 2 generations ago, but still compared to all other professions, I think doctors still are held in the highest regard and esteem.
Well, yes, no, I think that the numbers definitely support this. I think what I was referring to is maybe some feeling that's out there in the ether, but you're right. And I believe that doctors still go through a lot of training and are really directed by an ethical compass that really is hard to find nowadays. And if you find a good doctor, it's really more than just your specific disease that might get better, but also I think your life as a whole. And you mentioned, speaking to this, somewhere there, a quote, I believe, talking about this relationship between the doctor and the physician. And you say, a comfortable and trusting relationship with your doctor increases the therapeutic outcome. So here you draw a real line. I mean, you draw a line from this trusting relationship. So if you get a good relationship, you will have a better outcome, almost telling patients that, they should really work on this relationship because it will improve their health. So can you explain that?
Yes, I think that's exactly right, that you captured what I had hoped to say. What I think the way to understand it is to realize that there's something called the placebo effect, and that is a very important concept in therapy. People just don't appreciate how strong an effect the placebo effect is. It's really 30 or 40%. What I mean by that is that if you do a study where you have controls of placebos, placebos will work 30 or 40% of an active. An active has a very hard time beating that sometimes and frequently. So there was a book called Lonesome Dove, and in some people might remember Lonesome Dove. The main character had this bottle of pills, and they were called universal pills or something like that. But he just took them for whatever ailed him, whatever his sickness was, he just took these pills. You might think that I'm dwelling on this a lot, and I am, but the point is that everything about your encounter, for example, the common thought that when you call the doctor, you're already better. You make the appointment and you get better. Everybody's found that to be the case. That's a placebo effect. Placebo effect is a real effect. There have been attempts and successful attempts to show that the body chemistry changes in response to placebo, or a placebo could also be thought of as a sugar pill, but it could be a fake injection or just a real injection with water or saline. So what I'm trying to say is the involvement in the health system and that the idea that you're going to get better has its own effect. And it will be a stronger effect if you're part of the system that you're in, if you're partial to the system, if you like the system, if you believe the system. In other words, if you think the doctors are great where you go, if you think the nurses are terrific, if you think the office is efficient, if you think it's a beautiful environment, if you think it's a healing environment, it will be much more able to be effective than if it's the reverse. If you feel that the doctors don't care much about you, or the doctors aren't very well trained, or the nurses don't have any empathy, or the system is, the rooms are dirty and no one cares about the system or the healthcare environment, that will be not likely to be as effective. Even surgery, you could say, well, surgery, it's a mechanical thing. I mean, they hook up your blood vessels, they replace your organs. Yes, to the degree that it's mechanical, you would say, well, it can't be a placebo effect, but it's not true. Your result will be much better. Your follow-up will be better. Your post-surgical time will be better. Everything will be better if you think you have a good doctor, you think you have good healthcare deliverers. So I think it all starts to understand that you have to understand that the placebo, the so-called sugar pill, has a tremendous effect.
Yes, and I think you point out also to the need of the patient going into that relationship to be cognizant of that, to really actively work on this to improve the outcome. And I think you illustrated beautifully also in the chapter there. You talk about the placebo effect. I always think about it as the power within, the real power of the body to heal itself, which is one of the core tenements of integrative medicine, which we really like here at Learn Skin. So thank you for supporting this. I must, Bill, read again from chapter 6. This is, I guess, your summary of a study from the Journal of Sexual Medicine in 2009. This is, again, speaking about the placebo and understanding the power of placebo effect. And here you describe in the study, participants were split into 3 groups, right? So the first group was told that they will receive treatment, pill for erectile dysfunction. The second group was told, they told them, you're going to receive either a placebo or the actual treatment. And then the third group was told explicitly, you will get a placebo. But then all 3 groups, in fact, were all just given a placebo. So no one got real treatment, all got starch tablets. But what was interesting is that the erectile dysfunction in all 3 groups improved significantly. And there was no difference between the 3 groups. So really, a study this is placebo showing a real biological outcome. And again, extrapolating from that into the doctor-patient relationship is really an incredible way to think about it. So unifying this doctor-patient relationship with the power within and integrative medicine, I can't think of a better way to end it with this kind of encouragement for patients and doctor to really work on the doctor-patient relationships, because at the end of the day, this is a great way to get good outcomes, which is what we want for all our patients. And I want to thank you, Bill, for joining us. Folks, again, this is a book titled From Vulnerable to Empowered, Transforming Your Medical Health and Doctor Experience. I believe people can find it on Amazon, right?
Yes. It's only available on Amazon now, but in a few months it'll be available. It should be available in bookstores.
Excellent. A great read, and we will post a link for that in the episode description, so feel free to take a look at that. Bill, thank you for your time, your expertise, your mentorship over the years, and I look forward to more books from you. Thank you again.
Very good. Thank you.
And that's a wrap for today's episode. But these conversations are just way too good to end here. Wouldn't you agree, Raja?
Absolutely, Hadar. That's one of the main reasons I get so excited about our conference, the Integrative Dermatology Symposium. Every year, it's a chance for us to continue expanding our minds for what's possible in dermatology for our patients, and also to bring the latest clinical knowledge back to the clinic. And this year's theme has been long awaited. Do you want to spill the beans?
Oh, yes. You don't want to miss this one, folks. This year's theme is Nurturing Skin Resilience, the Science of Aging and Wellness. And it's happening from September 26th to the 29th, 2024.
Yes, and we'll cover topics from conventional medicine to traditional approaches, from inflammaging to exosomes, and from cosmeceuticals to women's health and more.
The agenda lineup looks amazing. Not only the topics, but also the real-world case discussions, workshops, and networking events. No wonder we've expanded the IDS to 4 days. So much more to learn and do.
Plus, you can't go wrong at a brand new resort that just opened up this year at the Lowe's Arlington Hotel and Convention Center in Arlington, Texas.
Texas, here we come! And for our esthetician colleagues, please join us on Sunday for the Integrative Aesthetics track.
So come check out integrativedermatologysymposium.com for all the details. We hope to see you there.